Hello, everybody. Welcome to the Cancer Education Series. I'm Becky Pospisal, Director of Mission Delivery for Above and Beyond Cancer, and tonight I'm filling in for Dr. Richard Deming. We are at the Mercy One Health and Fitness Center here in Clive, Iowa. The Cancer Education Series is brought to you in part by a grant from the Iowa Oncology Society and in partnership with Mercy One. Tonight, we're going to be talking about the role of physical activity and exercise in optimizing your health. And tonight's guest, hi, Elizabeth.
Hello.
This is Elizabeth Lefferts. Did I say that right? Thank you.
Yep.
I even practiced before we did that. Elizabeth is an assistant professor of kinesiology at Iowa State, and she's got a lot of great information about the research she's doing about the benefits of exercise, especially for cancer patients.
Yes.
So welcome.
Thank you. I'm excited to
have
be here.
you.
Yes, thank you.
Why don't you tell everybody a little bit about yourself?
All right. So my name is Elizabeth. I grew up in Iowa. So I am actually from the very small town of Greene, Iowa. Most people think it's in Greene County. That's not true. It's actually in Butler County, very northeast between Mason City and Charles City, if those places mean anything. Yeah. So I went to North Butler High School, very small school, grew up in a very small town, so rural Iowa. And I went on to first do my training at University of Northern Iowa in athletic training. I thought I wanted to be a physical therapist. Turns out that wasn't exactly what I wanted to do. So then I came to Iowa State to do my master's, and I did that in physical activity epidemiology. Fancy words to say, looking at how physical activity impacts health on like a large population level. So not, small individual perspective, but in a very big perspective. I did a study that looked at how different exercise interventions, so if we were doing aerobic exercise or strength training or a combination of both, how that might influence blood pressure in middle-aged and older adults who had high blood pressure. And, firm believer that exercise should always work and do everything, and it didn't exactly do what we wanted it to do. So it moved a little bit, but not as much as expected.
Interesting.
And so I was like, why, right? Like, why did that happen?
Sure.
The inquisitive person in me. And I was like, okay, I guess I'm going to keep going to school. Why not? And so I went on to get my PhD, and I did that in cardiovascular exercise physiology because I wanted to know why their blood pressure didn't move. And so I did that at Chicago. So I moved away from Iowa, finally went to Chicago. And then after that, I came back to do another postdoc back in that epidemiology world. And now I'm an assistant professor. So I guess that's a very long, short story of how I got back here.
Yeah, that's awesome. So you left Iowa, you came back to Iowa. Has sports always been a part of your life? How did you get involved in this?
Yes. So I would say sports started it, right? Small town, high school sports, loved basketball and volleyball. If I stood up, I'm a very tall individual. I am a tall girl sports kind of person. And so that's what took me into athletic training and that physical therapy, because like it's typical story, I got hurt. I went to physical therapy. I thought that was a really cool job. And I learned that I love what a physical therapist does. They are clearly very important people in this world. But kind of I'm not going to call it monotony, but it's more monotony than what I have in my daily life right now, and what I get to do and kind of the questions I get to ask. And I realized that just after doing shadowing and some of my training, that just wasn't exactly what I wanted to do. And so, getting into that physical activity and exercise realm, I stayed active, but now it's not so much as sports. It's how does physical activity and exercise improve health instead of looking at it from a sport perspective. So sports, yes, I still try to pretend I can play volleyball and do like some rec leads and stuff like that, but
It gets a little harder, doesn't
it's questionable. So sure,
good.
sports are still me and me, but maybe not as good as they were once.
Sports change a little bit as you get older, right? Yeah, a little slower.
Yeah,
so very good.
Still
Okay.
moving, but
Very good. So with your job at Iowa State as a professor, what are you teaching?
Yeah, so I teach exercise physiology, essentially the physiology behind the different main systems. So cardiovascular, our metabolism, our muscles, a little bit of endocrine and hormones, but essentially things that change with exercise. So we go through kind of the physiology, just baseline physiology, and then we talk about how does our body respond to we call it like acute bout of exercise. So if I go get my bum kicked in the spin class after this for 45 minutes, and I will. What does my body do to be able to do that spin class? How am I
Okay.
responding? How am I capable of actually doing all of that hard work? And then we also talk about how does my body respond over time, right? So if I do exercise consistently for weeks on end, what is kind of those like adaptations or health benefits that I get from doing that exercise?
Very cool.
So that's one course. And then another course that we have is called Medical Aspects of Exercise. And that gets more into like those disease states. So how do we use exercise as medicine for different like chronic conditions?
Oh, I love that.
And yeah, how would you, a lot of those students are exercise science majors. How do they, go out to become personal trainers or go back, further for schooling and their medical careers, and how could they promote exercise as a medicine in their like medicine career? Because that's oftentimes, unfortunately, not a lot of the curriculum, like in med school and stuff. They have lots of things to get through, and I totally get that. But I'm biased, obviously, that I think they should have an exercise as medicine component.
Yeah, absolutely.
It's a good preventative. It's a good treatment. It's it's good for all sorts of things.
And we know the research shows that exercise, especially when you have a comorbidity or if you're suffering from an illness, that really can help with side effects. It can help with fatigue. It can help with stress level, all that. And it's something that you can do for free, right?
Correct.
You can do it anyway. So
you can if you find the right thing.
That's awesome. So you are teaching undergrads.
I teach undergrads.
Okay.
Yep. We do offer some graduate level courses, and those are for our grad students. So I have a PhD student right now, and we have 3 PhD students in our lab. PhD just meaning they're going for their doctorate, kind of like I did in research, not a doctor of medicine. And then we also have some master's students. So those are those 2-year degrees that work with us as well.
You're setting the pace for the future.
Trying to set them up for the future. Yes.
That's good.
Hoping my mentoring skills are good to get them on to, continuing to push the button.
That's great.
Yeah.
So to turn a little bit towards cancer, obviously that's the population we serve at Above and Beyond Cancer. So tell me about your connection to cancer.
Sure. I think like everybody, of course, we always have a connection to cancer, and whether it's big or small, it all is not, always great. So yeah, cancer connections are big. I have 3 aunts who have all passed away, but they all had breast cancer. I have 2 grandparents that had cancer, and then most recently my dad had cancer. So
sorry.
Yeah, it's it's one of those scary things. And it's okay. They've all made it through their cancer treatments and made it into that survivorship. And so that's kind of where some of my interest comes from. The cardiovascular system I find very intriguing from a physiology perspective. And the cancer interest is obviously personal from the sense of just being able to be helpful and use my education for something good for society and like a public health messaging perspective. So that's kind of what got me intrigued. And of course, there are still many research questions out there about physical activity in cancer. And with our increased ability to fight cancer, we also have many side effects from some of those treatments. And so that's where that cardiovascular system kind of comes into play.
So you are a researcher.
I am a researcher. That is my job, is to ask questions and try to find answers. So
that's really great. So tell everybody what you're working on right now.
Yeah.
It's a lot.
It's like, where to begin? So what am I working on right now? Literally right this instant, I have a more physiology-based study going on with cancer. So we know that chemotherapies can be cardiotoxic. Certain kinds of chemotherapies are more cardiotoxic than others, meaning that they have damaging effects to our cardiovascular system.
Right.
So a lot of what we know is about the heart, and we are learning a decent amount about how our blood vessels work and how chemotherapy can impact our blood vessels. And I am more of a cardiovascular physiologist. We can dive into all of these niches where you end up in the research world, I should say.
Sure.
And so what I am currently looking at is how do chemotherapies that you've received via infusion, right? So they travel through our vascular system. We know that their great job is to get rid of those bad cancerous cells, but there's a chance they're going to take some other cells with them on their way. They're going to cause some reactions in our bodies that create some what we call scavengers that eat up some of the good stuff that we use to keep our blood vessels functioning and dilating.
Okay.
So my current question that I'm chasing is one, just looking at how does chemotherapy impact how our blood vessels can dilate when we compare individuals who have a history of chemo to those who do not. And then it has two parts after that. The first one is if we give them an antioxidant, which is just vitamin C in this case, not saying that people should take vitamin C all day, every day. We're using it more as just an exploratory mechanism. Does that improve the vascular function? Because that is part of what we think is getting scavenged, essentially.
Interesting.
Is what we call oxidative stress. So antioxidant gets rid of that oxidative stress. Does it make it better? And then the other half of that question is that physical activity and fitness question. So if we have cancer survivors who've undergone chemotherapy, but they're active, are they essentially able to combat that? So do they not see some of those detrimental changes that we might be expecting from that chemotherapy? Because if we think back to that class I was teaching, the chronic benefits of exercise training are improving or maintaining that vascular function as we age. And so sometimes we think of that chemotherapy as being kind of something that accelerates the aging of our vasculature. So we kind of think like trajectories. Maybe this is my normal trajectory. It's going to go down as I get older. Unfortunately, chemotherapy is probably going to do something like this, but we know physical activity can like put it back up here. So it's kind of that same thing is if we exercise, can we like shift that line back up and kind of decrease that risk of cardiovascular disease and some of those other morbidities that we know come? It's a very long-winded answer,
well,
but that's what we're doing.
Yeah, that is fascinating. That's so interesting. So I know there's studies out there already that really show the benefit of exercise while you're in treatment. So since there's studies out there and we know this, American Cancer Society has published, put these out there. We know that these are peer reviewed, they're scientifically backed. So would this be something that would support that, or would be more on a micro level of, because you're really focusing on the heart, right?
Yeah. So we're focusing on the vessels. We do the heart function as well, because if we're going to measure it, we're going to measure everything we can, right? We might as well get it. This would be supportive, potentially. So many of the guidelines that you're probably talking about are related to like physical activity guidelines. So including this in the literal physical activity guidelines for a physiology-based study is typically not exactly where they're going to draw that information from.
Okay.
So this is the theory behind this from a public health relevance is, if we identify mechanisms or that it would support the fact that you should do physical activity, but it's not telling us necessarily how much physical activity you should be doing. Or the other thing would be that if we identify that that antioxidant is working, it could provide a kind of targeted therapy that someone a little smarter than me who knows how to develop drugs could figure out how to, maybe target that with chemotherapy treatments or something like that to try to decrease some of that cardiotoxicity that we see. So that is the like physiology stuff. And back to those big words, that epidemiology, that is where I'm interested more in those like exercise interventions and more so actually physical activity interventions. So exercise and physical activity are technically two different definitions where physical activity is motion and action that you can kind of do throughout your day, whether that's walking around this room, walking to and from for transportation, gardening,
chores,
vacuuming, chores, right? There's all sorts of different domains. Exercise,
not intentional,
correct.
Right?
We usually think of like structured and intentional. And so, I think the world knows that we should all be physically active.
We do,
right? Everybody knows that, but like literally being physically active is hard.
It is.
I mean,
for everybody.
For everybody. Like it doesn't matter. I live in the world and I still find it difficult, right? So behavior change is hard, especially if it's not something you do. Finding time is hard.
Right.
So the other thing that I'm in the progress of working on, of getting started, is essentially a like home-based physical activity intervention. And I think the goal of it is to kind of address some of those barriers. So I think that sometimes thinking about starting exercise and physical activity is scary, right? It feels like you have to just all of a sudden go from watching my TV to being this person who exercise is
doing a
hard.
video in the living room.
I have to be sweating. I have to be breathing really hard.
Buying
And
equipment.
if I'm not, it doesn't count.
Right.
And so this intervention is just step-based. It's just, can you increase your steps? I don't care how you do it. I don't care if it's standing in your front room. I don't care if you go for a walk with your friend. We've done a little pilot study, not in cancer survivors, but just in older adults that showed just increasing your steps by 3,000 steps per day, about 5 days per week, is enough to like lower your blood pressure.
Wow.
So just trying to find like baby steps that are just more realistic, maybe to the general population, than feeling like you have to, go hit the gym for 30 minutes every day, or you have to buy a fancy treadmill, or you have to, I don't know what it could be, but
10,000 steps every single day. And that might not be physically possible for especially somebody who might be older or just through treatment. Right.
And that's just another, public health. At some point, someone came up with that 10,000 steps number. And I think we're starting to learn that maybe that's not accurate for everybody. Like, there's some studies now that show that maybe it's just 7,500 steps per day is kind of where you start to bottom out on your health benefits. And, if you think about someone who maybe only gets 1,500 steps today, even jumping to 7,500 steps per day, that's a lot. That's too much, right? That's too much. That's too hard. I've been trying to think about like increasing my steps, and that's hard work,
especially in Iowa when it's not nice half of the year. So like if you don't have access
to a treadmill,
how are you going to get 10,000 steps in your house?
Correct. Yes. And so that's why we kind of started thinking about, well, like 3,000 steps is typically about 30 minutes. Physical activity guidelines say we need about 150 minutes per week of moderate physical activity, which is just the stuff that makes your heart go up, you're breathing a little harder, but you could still talk. Like I could go on a casual walk, and that's moderate level physical activity.
It's still steps, right?
And it's still steps. It still
need
counts.
to do the 30 in a row, or could you do 2 15s?
Yeah, I don't even care if you can do it in 5. You can just walk around your house randomly all day.
Okay, I like that.
I think the bigger message, other than obviously we have to count something from a research perspective, we have to have an outcome. But the idea is more of like move more and sit less, not like get out there and go.
Yeah, that's not this hardcore attitude. It's more like do something different than
just move your body.
Oh, I love that.
Yeah, because you can think about too. Some people, they can't do those long bouts.
Right.
Especially when we think about the cancer survivor population, or during treatments when you're really tired, or your joints hurt, depending on the type of cancer you're dealing with. That's just not feasible. So it's just trying to find ways to make physical activity accessible to everybody, and something that they feel confident that they can actually do, instead of being so maybe scary, I guess. Yeah.
Well, and I love the idea of you using the word accessible, because especially in rural Iowa, you lived, I'm from rural Iowa.
The intervention is meant for rural individuals who don't have access even to, like above and beyond. Yeah. I mean, you guys give great resources to come and like do the spin class, but there's research out there that shows, like, especially Iowa being so rural, there are people who have to travel 45 minutes to an hour. And you think about transportation or gas or childcare.
Oh gosh.
Or all sorts of things that are limiting. I mean, I wouldn't even give up 45 minutes to drive to a spin class on a regular basis, and I love exercise, so like, why would I expect someone else to do that? So
you really, living in a city like Des Moines, you take for granted that we have gyms everywhere here. We have sidewalks, we have paved surfaces, we have lit streets at night, and so you can walk safely places. And you think about, and are you going to walk down your gravel road in Green, Iowa? Maybe you work 12 hours and you come home and it's dark, especially in the winter months when sometimes it's dark when you go to work and it's dark when you come home, and it's so depressing. It really can be, right? And so your mental health takes a dive, and the last thing you want to do is probably work out or exercise or go for a walk when you're not feeling great. And so we know seasonal affective disorder is real. And even if you're not being treated or have a cancer diagnosis, for a typical person, that is very normal in Iowa. So I love accessibility. And that is something at Above and Beyond Cancer we hope to address, with some of our virtual programs. We haven't quite tackled all that. We do have some virtual programming coming out, but I think that'd be really great to, especially in rural Iowa, when you think about the nitrate levels in water and more people being diagnosed with cancer, and Iowa being the second highest cancer rates in the country, what can you do that doesn't cost a lot of money,
Correct.
that doesn't take a lot of time, that doesn't require you to get a bunch of equipment or drive 45 minutes,
Correct.
right?
Yeah.
I mean, I just love that idea. And I think that it's just so in alignment with our mission on what you're doing. I just think that's really great. So you do have a group of people or you've started with this, correct?
We are getting this one up and running.
Okay.
So, if anybody wants to volunteer,
this is a shameless plug for
this
her.
is a shameless plug. Yes, that we will be taking participants.
Great.
Participants for both studies, but so this one occurs literally pretty much anywhere in Iowa.
Nice.
The physiology-based studies, you do have to come to Iowa State to our lab because that's where we have our ultrasound and everything that we can do our more detailed assessments for the physical activity intervention. That is not the case. So
very nice.
Also makes, in research, that world, rural involvement is also slim because as you can, it's the same idea of not having those gyms.
Yes.
Research is usually done on a university campus or in big cities. So including those individuals in research also gets more difficult. And so it, increases generalizability of our findings and kind of determining, does the same thing happen? There's not really a good reason it wouldn't happen or wouldn't have the same effects, but maybe not.
Sure. So I know we're going to put Elizabeth's email up on the screen during the broadcast. So you'll be able to contact her directly if you are interested in participating.
Yeah, absolutely.
There'll obviously be some guidelines and some questions probably. So we can't guarantee that you're
correct. Yes, unfortunately, there's going to be inclusion criteria.
Yeah.
It's not super strict, but there are some
of
just because we have to have some internal validity things. But yes,
it sounds like a great opportunity to maybe have something structured to kickstart.
Yeah.
If you're going from a sedentary lifestyle and you're ready to maybe do something, but you're nervous about how to do that or not sure how you could make time or afford to do that, this might be a great option for you.
It would be wonderful.
And of course, our programs at Above and Beyond Cancer are also free. However, if you're not local or transportation is an issue or the classes don't really align with what your physician would like you to do, walking is something you can probably always do.
It's true.
Yeah. Very cool. So if you had unlimited dollars.
Oh boy, yes.
This is like my favorite type of thing because we know if money was not an issue.
Yes.
And you could really tackle something in your area of expertise. What would it be?
Oh, if I had $1 million, I need more than $1 million.
It
would
would be a little more than $1 million probably.
If I really wanted to do it well, I would need more than $1 million.
Yes.
If I could do whatever I wanted, it would be rough, but in a literal perspective, I would do a physical activity versus exercise type of intervention. Just because there is a lot of data in both worlds, and you can always argue that exercise is a higher intensity, so you could have greater adaptations from an exercise adaptation perspective, but we know physical activity is beneficial. So could I put a camp of physical activity or exercise is better? And with or without resistance training, like lifting, weight training or resistance bands or body weight. It wouldn't have to be like in a gym per se.
Sure.
And looking at a longer term, so it'd have to be a long intervention, and getting still all of our more physiological niche type of parameters. So that how does that vessel dilate or not dilate well? I could come up with a million questions that I would love to answer. I think that would be my biggest one, would be definitely an exercise versus physical activity intervention on cardiovascular function in that cancer survivor population.
Very
figure out if we should be actually recommending exercise more than physical activity.
Right.
Or, my hypothesis would be that both of them would eventually lead to the same end result
at some point, maybe different timelines.
Maybe the exercise would get there quicker and physical activity would take longer because you just need a greater dose.
Sure.
Right. Accumulation, essentially.
That makes sense.
I would hope that they would both end up in the same.
Well, we'll put some good energy out there for you to
put
get
out
that.
the good energy to all of the grant funders out there that they're going to be, hopefully sending some money my way.
I know. There's some heavy competition out there.
Very heavy competition. Yes.
Interesting. So what do you see for yourself in the future with your career, with your research? Is this something you want to continue doing different research studies over the years? Do you have an end goal for what you're doing?
I don't know if there's ever an end goal in research. I think the questions keep coming. feel like you do one study and then something doesn't necessarily end up exactly how you wanted it to go. And so you're like, well, why didn't that happen? And then you move on to the next. Or, for the physical activity intervention, it's start small. Hopefully I can get some funding. We can do it bigger. The idea after that would be to change the dose, right? So we're starting with 3,000 steps, but can you just do 2,000? What happens if you do 5,000?
Sure.
There's always questions. So no, I hope to be in this space for a long time, and I hope it gets me to 10 years so I can keep my job.
Yeah, that would be great. Kind of
and
sounds
it'll keep going.
Yeah, it kind of sounds like one thing creates a new question, right?
Yeah.
After you finish that. That's really interesting. Boy, I'm learning a lot about research.
Great. Wonderful.
It's been a long time since I took a research-based class, probably about 20 years or so. So really interesting.
So that's what we do. And, I guess to me, physical activity never gets boring, because even though I'm primarily interested in the cardiovascular function aspect, within all of our studies, we're always asking about how does it impact other signs and symptoms, right? Fatigue, stress, depression, anxiety, quality of life.
Yeah.
We often like to look at body composition over BMI.
Yeah.
Just to see if things are changing there, strength, just everything from
flexibility,
a
things.
more holistic perspective. Just because we know that although I love the cardiovascular system, it has so many whole body benefits that I think it's important to see where else people are.
Well, it's motivating for people too, right?
Yeah.
I mean, in our evidence-based classes that we have at Above and Beyond Cancer, we do pre and post assessments. And those are things that we measure. Absolutely. We do kind of the qualitative, like how's your quality of life? Is your sleep better? Many of the people that are in this room have probably done that with Mary, our program director, have had a pre and post assessment. So, and we do measure, some of those quantitative things as well. Or, did your body fat percentage go down? Right. Are you able to do more steps in a certain amount of time? And it is incredible, the results from a 12-week program. Just having somebody commit to 2 or 3 days a week of one of our classes, you really just get this. I mean, I was not that I didn't believe it.
But not surprised.
It's like you do, right? But then just to see the results, I was like, wow. I remember the first time Mary had shown me the data. I was so impressed to see, folks that number one have committed to doing something, post-treatment or during treatment. We've had people do it with a port in, it's very motivated, ready to do it. Their doctor's like, yep, go for it. Yeah. And then people who are, years into their survivorship, and it's just the outcomes are just so great. And really just the community that you can create too.
I think that's also one of the fun benefits of when you do it in person, is that you do create almost like a cohort of community and people to talk to, and that social interaction, which we also know has so much benefit, right? So research is endless. You could look at the group type of physical activity interventions. Does that have a better experience for individuals who are going through treatment or in their early survivorship or late survivorship? It does not matter. Versus maybe someone who's, there's all sorts of new data on just being being outside and the benefits of being in the woods, in the forest, right? So what if you put them in the woods and told them to hike every day instead? What does that do? So,
absolutely. I mean,
I don't live in Colorado, so that probably isn't as feasible around here. But
we have some forests here. We do hike and yoga.
Or something.
Yeah. We do hike and yoga at Greenwood Pond, and we've done forest bathing. And
nice. Okay.
That's very popular. And so we definitely understand the benefit of being in the woods and being in nature. And you're right, we don't have the forests here that you could probably get other places, but maybe in more rural Iowa. I mean, you may have more access to places where you can see the stars, right? And places where you can have total silence, which kind of hard to get silence in Des Moines sometimes, depending on where you're at. So it's very interesting. And I could see that being a huge barrier for the rural community. If you may be the only person in your town that of that has cancer, right? Correct. And so starting a fitness program, starting some kind of physical movement, whatever that might be, by yourself is even scarier. But if you had a buddy, right? I could really
social support is huge.
Oh, huge. Yeah. We all know if your spouse or your partner or your best friend, or you're going to see the same people at spin class every week, you're more apt to go, right?
Absolutely.
So, but it does, that it has to be hard. That has to be really difficult. Another barrier to think about.
There's barriers everywhere.
It's just endless.
Yes,
isn't it?
That's what you tell me an end goal. I don't think I can have an end goal. It'll always
be
something else to fight, and not fight. It's not a fight, but to try to overcome and be able to get physical activity more on the radar and find ways for people to do it. That's the hardest
Right.
part.
Yeah, the barriers will always be there,
Yeah.
right? So giving people tools that they can overcome is the most important thing. And I just love what you're doing, and it's
Thanks.
just so interesting.
Thanks.
And I just think it's so for our audience, probably so right on the money of what a lot of them believe in. And Dr. Deming has really preached for the last almost 15 years of Above and Beyond Cancer about the benefits of having a community and moving your body and getting outside. We always say get outside, right? Yeah. The benefit of just doing some of those things is just right on the money with our mission. And we just think that's so great what you're doing.
Wonderful.
And I'm just so happy
Yes.
you can share that with everybody too. So, George, are we at a point where we can ask some questions to our studio audience today? So we do have some people that did come and watch the cancer education series today, even though Dr. Deming is not here. So thanks for being here. We will take your questions. Actually, Elizabeth will take your questions, not me.
Can let you try.
Well, no, better not. Okay.
Elizabeth.
Yes.
Do you look at heart rate with activity versus physical activity?
Do you mean like the response to like one exercise bout, or do you mean like the training adaptation and heart rate?
For example, today I did not work out at home.
Yes.
Or I didn't work out here at the fitness center. Just did things around the house. And where my heart rate was today compared to when I worked out here, do you look at those to see how it makes a difference?
Yeah, so we often use heart rate to register intensity of your exercise, right? What have you been doing? And so oftentimes we correlate our adaptations to exercise with the intensity that you've done it. So we would expect more health benefits in the sense of like, especially the cardiovascular system, if we get into like a moderate intensity range. So a pretty elevated heart rate where you feel like you might be breathing a little bit heavier. But you know, it's kind of back to that physical activity thing. I still think physical activity, we know it still has those improvements, because just to move, our heart rate has to go up, right? So we literally just stand right up, our heart rate's going to increase from sitting here in this chair. And so we're still, you can call it stressing our system, even though not quite as high as if you would have come to the gym this morning or, you know, going to spin class in a few minutes. So it's just kind of different exposures that our body gets, but you're still stressing the system. So it's not a bad thing if you don't work out every single day, right? You don't get up to that higher intensity, that increase in heart rate. You should still get benefits from moving.
So usually when I get to 120, I think, okay, I am in my cardio.
Yeah, absolutely.
So if it's below there, when I walk the track upstairs, I cannot get my heart rate up that high.
That usually means you're probably in pretty good shape. And so we would not give a like blanket heart rate prescription to people, because heart rate prescriptions usually are based off of what we would expect your maximal heart rate to be. And so a maximal heart rate is expected to decrease with age, just like all sorts of things change with aging. And so we often use something called a heart rate reserve. So we would do a percentage. The most basic way to calculate your max heart rate with age is 220 minus your age would be kind of your predicted maximal heart rate. And so we take math. We take that based on your resting heart rate and we multiply it by a percentage and kind of add it back. So we would not say, you know, Becky needs to go to 120 and you need to do 120 and I need to do 120, because 120 for all of us is probably a very different exercise intensity. And so that's also, you know, important from a prescription perspective, because it just wouldn't be fair if I told someone who has been very sedentary for most of their life to just hop up and go get to 120, right? That's going to could feel really, really difficult. But there could be someone else where I tell to do 120 and they're going to feel like they're not doing much at all, right? So the goal is to, you know, try to individualize that prescription when we come to intensities. If we're going for that more like exercise-based activity. That was a long-winded answer, but that would be my answer. Yeah.
Thank you.
Good evening, Elizabeth. How are you tonight?
I'm doing good. This is
Good.
fun.
Good. Well, we talked a lot about cardiovascular and heart, and the other thing that goes with it is blood pressure.
Yes.
Okay. So my question to you is, did you do any research or know anything about the effects of the different treatments that you get for cancer, which would be like your radiology, radiation treatments, and with the chemotherapy and things like that? I would think that would shrink down your veins and arteries and capillaries to a point where your blood pressure goes up, right?
It could, yes.
So if that is the case,
Sure.
and I had a cancer going through cancer treatment, as I'm going through the treatment, do you see any exercises which would be really beneficial for me to get my blood pressure down into the normal range?
So when we're thinking about blood pressure, typically it is aerobic physical activity. So the walking, things that are stressing your cardiovascular system, that are going to have the biggest impact on blood pressure and like blood pressure regulation. The kind of sciencey reason behind that is because when we exercise, our active muscles cause our vessels to dilate to deliver blood flow. So yes, they get bigger. Yes, to deliver that blood flow to that working muscle. And so we activate more muscles consistently when we're doing that aerobic continuous exercise. So that's where we've seen, I would say, some of the stronger benefits. But I'm going to caveat that if, aerobic exercise is not something that, someone can do when they're going through those treatments, maybe they're super fatigued or that repetitive motion is just not comfortable. There is still cardiovascular benefits from resistance training. So doesn't even have to be lifting weights, doing band exercises or body weight exercises. So typically aerobic has a stronger reduction in blood pressure, but resistance exercise can also help. But I would, off the cuff, recommend typically aerobic for blood pressure reduction. Yeah.
I have a question.
Yes.
So I'm a cancer survivor, but a lot of cancer survivors tell you that with that comes inhibitors that you have to take, like letrozole and all that. So it comes with its side effects. So it's always recommended to go to physical therapy, which I'm doing this aqua therapy, which is a really cool experience.
Yeah.
Because you're not going to take away those side effects, but you're going to adapt. But it's also working on a cardiovascular and all that. But with it comes neuropathy.
Yes.
And I hadn't had a chance to have that conversation with the physical therapist, but what could help with neuropathy in that sense too?
Yes, I know. I wish I had a better answer for you. I was looking some of these things up to refresh my memory before I came because I was like, I wonder what kind of questions I'm going to get. So we actually don't know a lot about neuropathy.
Do you want to explain what that is to maybe someone that's watching that doesn't know what that means?
Yeah, neuropathy could be, changes in feeling typically in your extremities. And so sometimes when that happens, exercise can almost feel dangerous, right? Because you have a risk of falling or changing. So one, that's a great thing to do, the aqua and the water-based activity. One, it's a little bit more of a safe environment from the risk of fall perspective. It's great if you have like joint pain and things like that because you are a little more weightless in the water. So it's less pressure on your joints. So unfortunately, I don't have a perfect answer for you about what helps neuropathy because I don't think research really knows yet in the sense of physical activity. I had my thing here. I was like, this is my cheat sheet for a lot of things about cancer related. And unfortunately, neuropathy is just not one that we have a lot out there. There are recommendations when we prescribe exercise about neuropathy, which is, to ask about those potential barriers and fears of falling or not being comfortable and making sure that you find activities that feel safe or don't put the individual at risk of some sort of injury. But we don't know a lot, to my knowledge anyway, about ways to improve neuropathy with exercise.
Well, another second part to this question is, I'm a type 2 diabetic. So there's one thing that I learned with the pain, it can make my blood sugar go up and my blood pressure go up.
Yes.
So I had a couple of incidents where I almost fainted. And they said, okay, and then we realized the blood sugar was going down quickly. And they said, okay, now we got to check your blood pressure. And I go, why? Because that gets affected too. And so sometimes it will throw it off on my sensor. And I'm like, okay, what's going on with me? What's hurting? And, sometimes it's just a sugar pill I just need to take because it just threw it off. But I've been running across those kinds of cases because I have to be careful for my heart
Right,
as
yeah,
well with those
absolutely.
things
Yeah,
happening.
I haven't personally come across those cases too much. I wish I had a really good answer for you other than, I mean, it sounds like you're doing all the right things, right? You're going to the aqua therapy, you're being active, which is great. I think being aware of those comorbidities that kind of start to interact with each other and how they change for you personally is the best way to, know how to handle your health for you. And also where that individual perspective comes in of trying to identify, what works best for your situation and how do we, as a care provider, knowing probably a little bit more of your physical therapist, knowing more of your history, could really come up with a good exercise prescription for you that is safe and helps, control those things. The pain reaction and changing blood pressure and sugar levels, the body is so connected in so many different ways that that makes sense to me why that would start to happen. And, sometimes that blood pressure response can be like a spike at first because it hurts and it's painful. And then as your blood sugar drops, then you might also start to have low blood pressure, right? Those things all, it's like you go from a high to a low. It's just a whole roller coaster ride there. But yeah, identifying individual things, being active usually helps us regulate as much as we can. And I wish I also had a better answer for that one for you.
Thanks for your question.
Yes, thank you.
Yeah, I think of one time I was taking Tai Chi, and my instructor, as he was in his 60s and very active, very much fit, and then he had a heart attack.
Yes.
Blockage. He had surgery, and then his recovery. He was telling me that during his recovery, that it took half the time to recover, to get out of the hospital, to come back to where he was. And during this conversation, it kind of sounds like this is, we start exercising when we're starting to get sick.
Right.
But
it's unfortunately not the right time to start it.
Yeah. So I'm just wondering, how is it that we be able to get our, the society to understand that we should be moving all the time?
If I knew the answer, I would be the richest person in the world right now. And instead, I'm not. I'm an assistant professor at Iowa State University. But
and Above and Beyond Cancer would probably not be here, right? Like everyone was already doing
that
this.
is the $1 million question. I think that I have lots of personal opinions. Of course, but I think it is a society level thing, right? If you think about when we receive our care, it's always when we get sick, we don't necessarily have a prevention forward type of medical system at the moment. We go get routine physicals and our practitioners should be telling us about the physical activity guidelines, but I'm guessing if I asked you guys to raise your hand on how many of you know the U.S. physical activity guidelines, it probably is pretty slim, if not at all, right? And so I think that's kind of a start, is that there are people who know those guidelines. So the guidelines are we should get 150 minutes per week of moderate aerobic physical activity or 75 minutes of vigorous per week. Essentially, 1 minute of vigorous counts as 2 minutes of moderate. So you can interchange those however you want.
Nice.
And then they recommend 2 times per week of muscle strengthening physical activity for all major muscle groups. Like those are our physical activity guidelines. It's nothing like hard or
not
difficult.
major.
It's not too big, but most people don't know them. And it's because, we're not necessarily taught them at any point in our lives. So I feel like physical activity and exercise, like you said, becomes something that people learn about as they start to become sick and not as the prevention thing. And so, even in the cancer world, individuals who are physically active have less risk of developing cancer. And then the good news, though, is if you've had cancer, those people who are physically active post-diagnosis have a lower risk of, for some of the major cancers with good survival rates, cancer recurrence or that cancer-specific mortality or all-cause mortality. So even though I don't want to be a negative Nancy saying like you weren't active before your diagnosis, so nothing good's going to happen. No, that's completely false, right? Becoming active even post-diagnosis for cancer or any comorbidity really still lowers your risk for, other bad outcomes. So yeah, like the individual, we know that people who, exercise before typically have faster recoveries because our body is just used to stress, kind of is what we think of it. But
too bad that we just can't have TV commercials out there.
Right? I know. I agree. It's crazy what we see on TV versus what I would love to see on TV.
Yeah.
But
Great question. Great observation.
Yeah.
Yes.
Wonderful.
Hi. You mentioned earlier, you mentioned a couple of programs, and you also talked about some pre and post assessments, I think, that you do within Above and Beyond Cancer. We're familiar with the organization, but we don't know a lot about the programming.
Sure.
And so I wondered if you could just share a little bit more about some of the types of programs that you do offer. And is it more limited in the summer because people tend to be more active outside, and then does it pick up again in the fall? So if you could just share a little bit more about the program.
I would love to. So Mary Van Hoeklam is our program director. She runs our Optimal Living program, which would be, if you think of Above and Beyond Cancer like a table, we have kind of 3 legs. We have our Optimal Living program, we have our hotel program, and we have our transformational journeys, which a lot of people have heard of, our big trips, our big hiking treks all over the world that we do. But in regards to the free programming, would be our Optimal Living program. We have more than 20 programs each week that we offer throughout the Des Moines Metro and virtually that are free to cancer survivors and caregivers. We do have I want to say, don't quote me, I think we have 8 of our classes that are evidence-based, which means there's scientifically proven to reduce symptoms, to have better outcomes for cancer survivors. Those programs, we have pre and post assessments. So we measure your results. So you yourself and our program staff can measure how you're doing with the programming. So some of our programs that we have, for example, that are evidence-based would be our Row and Renew rowing program. We have our Total Training, which is a strength training program. We have Aquatics to Restore Health, which is at several area indoor pools year round. And we have,
There's a walking.
Oh
one,
yeah.
right?
Yes.
Oh
Oh
my
my
gosh.
gosh. Urban pole
There we
walking.
go. Yeah, I was like,
We just expanded our urban pole walking is probably one of our most popular classes, urban pole walking, where it's all over the metro. We have 5 locations, I believe, for that as well. And then we have cooking and nutrition classes. We have book club. We have a YA young adult program as well. So there's a lot of options. Some of them are during the day, some of them are in the evening. Some we don't really have a ton of weekend classes, but they are kind of open to everyone. But we do an intake with you. We work directly with your medical provider to ensure that we are putting you in a program level that is appropriate for the type of care that you need, or symptoms or recovery that you might be in as a survivor. And so Mary Van Hoeklam, or we have 2 trained medical staff on that are contractors for us, will do this pre-intake with you and assess how you're doing, get information from your care team so we know, where you're at in your diagnosis, what your body is able to handle right now, and then we'll get you started in those programs. And so some of the programs take place in the gym. We have partnerships with the area YMCAs. We have Trail Point. We have, plenty of places that we offer. Well, my brain is not working today. I was on vacation last week, but I have no excuse. It's Wednesday. So, and we offer a 3-month scholarship to get you started so that you can do a 12-week program with us and hopefully see some results. And then many of our other programs take place in the community. So we have hike and yoga that is at Greenwood Park. We have Tuesday Night Cycle Club, which is every Tuesday in the summer. Indoor cycling, which is free. Dr. Deming usually teaches that on Wednesdays. He's not tonight, but one of our contractors is teaching that for us. And again, they're all free. So you can come and go to classes, sign up for them. There's no charge. Some of our classes do have a small fee, but we have scholarships available. And really, it's for you to create a community and for you to get moving and do something, right?
Yeah.
Something in wherever you're at in your journey. And so we do have more intense programs, and then we have some that, we have gentle yoga, which is great for post-surgical survivors who, maybe need to ease back into working out or exercise and are nervous about that, or maybe need to make some adaptations to the workout. So we really have kind of almost anything you could possibly think of that would fit where you are in your journey. In addition to the optimal living program, I'll just very quickly, we have the hotel program where we provide hotel rooms for people that have to travel more than 50 miles to seek treatment within Iowa. So people who are in rural parts of Iowa who are not close to a hospital system sometimes have to go to treatment Monday through Friday. Imagine having treatment all day and then driving 2 hours back to where you live. So we can actually provide hotel rooms Monday through Friday for you, which is a wonderful service that we do. And then, of course, our yearly annual transformational journey. We just did Patagonia, took 25 people to Patagonia back in April, and it was wonderful. And we will be soon announcing our 2026 journey, which is, if you know about it, you're not supposed to know yet. But we will be announcing that in August. So that's Above and Beyond Cancer. So we're a small and mighty staff. We have 4 full-time staff, and then we have about 12 contractors that teach our classes. They are all certified, trained instructors. Some of them have cancer training as well. And they're fantastic. I mean, everyone in this room can vouch for them. They're just really great. So that's us. Good question.
Yeah, I'm an old news guy, so I wanted to ask a current news question.
Oh, boy.
Just in the past week, there was some reporting coming out that it isn't so much the quality and the quantity of our physical activity, which is not too good, but it's the quality and the quantity of what we eat. And that
Yes.
really is creating the obesity epidemic, which affects your study and research and your area of expertise and that type of thing. Did you see that research? And was
I'm
that
not
interesting?
sure I can point
Yeah.
this exact same one that you did, but I can still comment on how
Yeah.
I feel about nutrition. Yes. So, even in the idea of cancer, obesity and BMI is a huge predictor of cancer incidence or even cancer recurrence or mortality. BMI being body mass index, right? So an estimate of adiposity, not gold standard, but an estimate, and very predictive of health in general. So good to use on a population level. And yeah, right. We gain weight because our caloric intake is not as good or greater than our caloric, I'm gonna say outtake, but that's not correct. Expenditure. What we burn just sitting here, what we're doing when we're physically active. And yeah, it has a lot to do with what we eat. It is hard, going back to rural, to gain access to fresh food. It's super easy to buy something that's prepackaged and you can make in our busy lives. And there's a lot of things within that nutrition that are contributing to our health risks. So yeah, quality and quantity are definitely important, right? Because if I could eat a lot of chips or I could eat, some apples, even if I ate the same maybe amount, they're going to have different impacts on my body and how it functions. So yeah, physical activity and nutrition, usually go pretty hand in hand. So when for this physical activity intervention, part of that is also Dr. Buckingham shut up at Iowa State. She is a nutritionist and a dietitian. So she is part of that as well to see, how does nutrition also change? Because sometimes when we become active, we just naturally kind of start to eat better. I don't know the mental psychology behind it. I'm definitely not a psychologist, but sometimes those things go hand in hand, or sometimes when we start to exercise more, we actually eat a little bit more because your body is hungry, you burn more calories, and that's also fine because you did burn more. And so, weight loss is not always necessary to have health improvements. And I think that's another kind of cliche out in the world that, for exercise to be effective, you have to be losing weight. And that's not true. You can have physiological adaptations without weight loss. And oftentimes, that whole scale is just a number thing is super important, because with a lot of exercise, you create muscle, and muscle weighs more than fat. So even if that scale is not moving, you could be having positive body composition changes, right? Where you're gaining muscle and you're probably losing some fat, but that number is not going to change. And so that can be psychologically super disappointing.
Right. We've all been there.
Yeah. It can be super disappointing to watch that not move, but you feel like you're working super hard. And so I think that's another, just public health message that needs to get out there, that of course weight loss is necessary in some instances, but it's also maybe not always the end all be all to success.
It's interesting that you said that sometimes when you start moving your body more, you start to eat healthier. But I think we all know that like after you're done exercising or taking kind of better care of yourself, and then you go to McDonald's. Don't get me wrong, I love a McChicken, but like it's probably not the greatest choice.
I mean,
right?
I'm going to be honest. Sometimes I exercise just so I can drink a beer at
And
night.
that's
So
fine.
like,
Yeah,
it's
right?
just, you
Yeah,
have to
it's
pick your,
a little balance.
yeah, it's
right?
balance. Yeah.
Yes,
So
but you feel better when
Yeah.
you eat better, right? And you
Yeah.
feel better when you move. And so you tend to not want to like mess up your progress because you're like, oh, I feel so good right now. And then you make maybe eat something that's a little heavy or fried or whatever. And then you're like, boy, I don't feel good now. And you're like, gosh, I felt so good earlier today. It does
had
mess
all those
with you.
endorphins I
Yeah.
released and they felt so good in my brain.
Yeah, it does mess with
Yeah.
your brain, but it just, I think that must be some of the science or the psychology behind eating
Correct.
healthy. It's
Yeah.
interesting.
Another definite cardio question.
Okay.
Somebody that doesn't have the ability, or maybe they're sick, or maybe they've got a job, doesn't allow them to work out, exercise during the week. You were talking about 10,000 steps a day. Well, they want to go out and hit it on the weekend.
Mm-hmm.
But there is a school of thought, old school in particular, you might not want to do that. That's like shoveling snow at the end of your driveway. When you jump out there,
Yes,
I mean, you
uh-huh.
could kill yourself
Yep.
doing that because you're not doing consistent, moderate quality exercise.
Sure.
You just can't jump in and hammer it like that.
Correct.
But is that better than nothing at all?
So there's some like nuances in there, right? So we actually call those people weekend warriors. So there is research out there. You could go to like a search engine and you could type in like weekend warrior, and you'll find out that there is research out there about those exact individuals, right? Who they don't have time to do stuff during the week. So one, I think that's the nice thing about steps is that you never had to like go out and get them for 30 minutes every single day or something like that. It's trying to find ways to accumulate them. And oftentimes, if you're working a desk job that you sit at, it's hard to do that for sure. But a lot of times, there are people who work construction or they work other jobs that they're constantly busy. They actually get quite a few steps throughout the day. But I would say, something is better than nothing. I think the difference is the intensity at which you decide to go do that on the weekend. So if you are super sedentary all week long and you decide every weekend you're going to go like get your heart rate as high as you possibly can and do something super vigorous, I don't know the exact science behind it, but that wouldn't be my initial like recommendation to you. It would be to do something more moderate, right? Where you could get your heart rate up, you can be a little out of breath, but don't like go from zero to hero until you've kind of worked yourself into it a little bit more. That would be my answer
You
to that
always
one.
hear in the fitness community, we all have the same 24 hours, but that's not true, right? Like,
No, mm-mm.
it's just not. Like some people's 24 hours look way different than others.
Uh-huh.
So
Absolutely.
that is I might have to look that up. I've never heard weekend warrior.
Weekend
but that
warrior.
is-
Yeah. Mm-hmm.
I know people that do that.
Yeah.
So interesting. Okay. All right.
Essentially, and in most things, the weekend warrior is still a little bit beneficial.
Sure.
So, because
Right.
you're still active in some regards. So.
But maybe not 120,000 steps.
Correct. Yeah.
Or 60,000
Maybe-
steps or
maybe,
whatever.
Yeah, no, knock it back a bit. But yes.
All right. Well, I'm getting the times up. So
All
Elizabeth,
right.
thank you so much
Yes,
for
thanks
all of
having
your
me. This has
expertise.
been so fun.
You are a wealth of information, and I think we all learned something tonight, and hopefully you did too. Thank you so much for joining us for the Cancer Education Series. If you're interested in watching this video or sending it to someone that might be interested in watching it, you can go to our YouTube channel. If you search Above and Beyond Cancer, this will be posted tomorrow, and you can share it with anybody who might be interested in our series. We do this series every Wednesday, so please join us next week. Dr. Deming will be back with a new guest, and I want to thank you all for joining us tonight, and have a great night. Good job.
Thanks. That was fun.
You did so